Durant près de 15 ans, j'ai travaillé auprès des enfants atteints de cancer en qualité de conteuse. Alors qu'un sourire peut tant en dire, j'avais l'obligation de porter ce masque. Imaginez le sentiment d'exclusion et de rejet que cela peut générer. Alors je rêvais de réaliser un masque transparent qui permettrait d'humaniser les visages, de voir les émotions et de sourire.
Back in 2015, we were working on innovative protective equipment for healthcare workers confronted to Ebola in Africa. One of them told me how frustrated and heartbroken she was about having to care for desperately ill patients without being able to show empathy because of the surgical mask. Not even a simple smile.
At that time, I also remember my kids and nephew at the hospitals and the flu epidemic with all these people, wearing masks. And I could see the potential of having a transparent mask.
For the Hello Mask project, we first tried to identify who would be the main beneficiaries of a transparent mask. It was the hospitalized children, of course, but also the elderly, and actually all the healthcare workers whose relationship with the patients would be greatly improved.
How to proceed in order to transform this idea into a real transparent mask, and who could do it?
We identified a team who had specific competences in the domain of textiles at Empa, the Institute of Material Sciences in St. Gallen.
We know how to produce homogeneous transparent materials such as glasses or plastics. So the scientific challenge was to introduce pores into the materials to allow for air permeability, filtration efficiency and transparency.
A transparent medical mask is, from a regulatory point of view, a medical device of Class 1. And as such, it needs to fulfill certain standards. This involves a defined bacterial filtration efficiency, air permeability, and resistance to liquid splashes.
We finally selected a method called electrospinning, a relatively new process in the industrial field. Using this method, we were able to produce porous and semi-transparent materials composed of micro and nanofibers.
After 2 years of research, together with our partners from Empa, we have succeeded in developing the material for a transparent surgical mask. A startup company named HMCARE was formed to commercialize this innovation, and it was able to successfully complete its first round of seed financing. We are very glad to be able to help improve empathy in medical care, which is so crucial for patients everywhere.